Hi everyone, and welcome to today's Product Showcase webinar, What's New in Simulation, where we'll take a closer look at the Laerdal Sonosim Ultrasound Solution 2.0 product that has been co-developed through our partnership with Sonosim, who are leaders in ultrasound education. My name is Danny.
And I'm Hanne, and we'll be your hosts today.
During the webinar, we will introduce and discuss some of the key product improvements that we have made to this training solution and demonstrate some of its unique features. The focus of these improvements has really been about providing the learner and faculty with a better experience, greater flexibility, and also control when conducting ultrasound simulation training.
So during this webinar, please use the Q&A feature at any time you have a question. We'll be monitoring the chat throughout, but we will also have some time at the end to take some questions. Okay, so Danny, why is it important to have ultrasound within our simulators?
Yeah, well, I guess, whenever we design a simulator, it's important for us to include as many opportunities for the simulator to be used across healthcare. And really, I guess ultrasound is no different. So we sort of made sure we wanted to include that. But I guess one of the main drivers is we're actually seeing that point of care ultrasound is being a lot more widely used throughout clinical practice. But we also know it's a difficult skill to learn.
Yeah, why is ultrasound a difficult skill to learn?
Well, I guess really traditional ultrasound teaching really requires sort of 4 elements. So first of all, we need the instructor. We also need access to an ultrasound machine, but we also need to access to a patient that has a certain pathology that we think. And of course, the other thing that we need is also time. But if one of these components is missing, then training or delivering training certainly becomes a challenge.
So how does this product help make ultrasound training possible?
Well, I guess, we have SimMan 3G Plus in front of us here. So he's a simulator that, can be used to sort of train rarely seen conditions or be put into sort of emergency situations. And really, this solution around ultrasound is on the same basis. Because it's a simulation product, you can use it at any time to complement traditional ultrasound training, also allowing learners to build competency in a range of skills such as image acquisition and also making a judgment on that. But I think the other thing that's interesting too about this product is although it's a simulator, the actual ultrasound images that we use are real. So you're actually manipulating real ultrasound images, and of course we have a whole range of patients available that are able to scan that show both normal and also abnormal pathologies.
Okay, so Danny, how do we add ultrasound to a simulator?
Okay, so I guess the first thing we need a compatible simulator. So this is the SimMan Plus that we have in front of us, but really any of the SimMan brothers will actually work with ultrasound, or ultrasound can be added, and we also have SimMum as well. So if you have one of these simulators already, you need to access or I guess add on a upgrade kit, and that actually prepares the simulator for ultrasound. We need a laptop with some software, and then a subscription, and the subscription actually gives us sort of access to all the cases for that particular simulator type.
Okay, so how many ultrasound cases does this product have available?
Well, we actually have 50 in total, and they're sort of spread across the 2 compatible simulator ranges. So for SimMan, we have 30 cases. There are 10 that focus on critical care. We have 10 for trauma and also 10 for cardiac resuscitation. And then for SimMum, we have 10 early stage pregnancy, but also 10 late stage pregnancy. I think the other thing too that also I should mention, we also have healthy patient cases. And the reason why we have the healthy patient cases is, and then that way you can actually train what's normal. The other opportunity too is that if you're actually running a simulation where you don't want any pathology within the simulator, you can still use ultrasound as a part of that if that's actually a part of their patient's assessment.
Yeah, okay, so Danny, you mentioned at the start that there have been some key improvements to this product. Can you tell us a bit about these?
Sure. Well, Hannah, the focus of all the improvements has really been around creating additional flexibility, not only for the learners, but also for the faculty as well. We wanted to ensure that the product not only could be used during a simulation, but could also be used to complement traditional ultrasound training for those who are just starting out.
Yeah, so can you give us an example of these?
Yeah, sure. I guess if we use the learning circle as an example, there are several segments where this solution now fits. Whereas previously the focus was predominantly on decision making, but also simulation in teams. So for knowledge acquisition, we've actually introduced 3 new guided cases where the product actually teaches learners how to do a number of protocols. So the protocols that we have available for SimMan, we have eFast and Rush, and then for SimMum we have the 6-step OB exam. And the way these are used is there's actual on-screen prompts that sort of guide the participant through. For skills proficiency, we've created checklists, and those checklists are downloadable from layerdor.com. And each of the checklists, there's actually one for each case, can be printed off, and say for example I could be using it and you could be performing the ultrasound and you could be verbalising what it is you're seeing. But I guess this also could be used for instructor training. So this is where, you know, as the instructor I could be sitting here and I know exactly what's going to be seen and I could actually guide you through the specific case. Each of the checklists contains information about the patient, so it sort of has the patient history. We also give the observations, and then we have a table that has all the available ultrasound windows and then what it is that they'll see, and we also provide the diagnosis. So for decision making and also simulation in teams, one of the things that we've actually changed for the product, and this is the one that I'm really excited about, we now have the ability to change both the heart and also respiratory rate of the ultrasound images. So these are controlled by Leap. And of course the advantage of this is that previously when you ran a scenario, you weren't actually able to change those parameters until the ultrasound had been taken, otherwise there'd be a mismatch from what, you know, the participant is seeing to what's being displayed on the monitor. So now, you know, if when running a scenario you actually wanted to deteriorate the patient, you could certainly do that, knowing that when the ultrasound probe goes on, there's going to be a match between the image and also the monitor. This feature is also beneficial for instructor-led training. So an example of that, Hannah, would be, say for example, if we were looking at the heart and what, you know, one of the pathologies we're looking at had to do with the valves. If it was really hard to sort of understand, seeing at a fast rate, we actually slow it down so then we can have a better look at it and the instructor would be able to explain exactly what we're seeing. And then it could be sped up to the rate, so that's kind of nice. I guess the last improvements that we've made have really been around the software. So we've created a new interface, which is really nice, but we've also created this sort of probe alignment feature as well, which allows us to actually customise the probe position with the image itself.
Wow, Danny, it sounds like there's been a lot of changes to this product. Is it possible to show us some of these?
Yeah, sure, let's do that. So let's start with the probe alignment feature that you'll see when entering the software. So you can see the screen now, and there are really 3 options. So if I start with the bottom one first, which is default, which is the one that you most commonly would use, and that's when the mannequin is sort of in its flat position, so it's lying on its back looking at the ceiling. So when we select default, then that's the layout. But say, for example, there might be times where we want to actually change the position of the mannequin. So say, for example, in pre-hospital, you might want to put them in a car, or even SimMum sitting up in a bed. What we can do now is actually build a configuration, so then that way the probe aligns with the image for that particular position. So for that one, we would select new. The other nice thing about this particular feature is that it actually created, I guess, a different option to be able to use this. And here's an example. So what I'm holding up here is sort of a SimMan torso printed on the paper, and we also have the tag locations that are highlighted there in the circles. But if I turn that around, you'll sort of see that what I've done is attach the same tags that you'll find in the mannequin skin, and of course you can get like additional sets to there. So what that allows me to do is actually to take that into a classroom or into a different setting where maybe the mannequin won't be available. So I can build a configuration for, you know, the actual paper lying flat or like in a vertical position like that. So I guess because we don't have a SimMum here, Hannah, maybe what we'll do is we'll create a configuration using one of these for SimMum. So Hannah's holding the SimMum late stage, so again we can see the actual tag locations. So on the software, I'm going to select new, and then it's going to ask me which mannequin, and of course depending on which mannequin that we're actually configuring is the one we select. So we're going to select SimMum Gravid. And now the first thing it's going to do is actually align the probe. So Hannah, maybe if you just rest that on SimMan, and I'll just pass you the probe. But if you place that into the centre there with the probe indicator pointing towards the head, I'll hit calibrate. So the reason that we need to calibrate is just so the probe knows the position that it's in. Now we're into the actual alignment software. So if I select SimMum Belly, so we'll just focus on just a couple of tags, but really what we're going to do is repeat this process all the way through. But in the interest of time, we're just going to focus on a couple of tags. But maybe, Hannah, if you just start with the bottom tag down there and just with the indicator pointing up towards the head. That's it, perfect. And now we can sort of see that this particular tag location is now highlighted orange. So if I select a line, it will then go blue, then I'm ready to go on to the next tag. So let's go to the next tag above that, which will be lower uterus. And again, now we're seeing that highlighted in orange. I select a line and maybe do the next one just above it there, Hannah. Great. And again, hit a line. And of course, we would repeat this process for every tag location. So now what I'm going to do is just select Finish Setup and then go OK. And then it's going to ask me to save it as a name. So I'm just going to use SimMum just as an example for this. And when I select Save, what will happen now is that configuration will be loaded. So then Hannah will be able to demonstrate anything on SimMum with this piece of paper in that plane. So the next screen that we actually go to is the case list. So this is where we just sort of decide which training it is that we want to do. So we have healthy patient training, we have the guided training, and we also have simulation training. So if I just talk about the healthy patient training as an example, when I open that up, you'll see that we have healthy patients for SimMan, SimMum Gravid, and also non-gravid or late or early stage pregnancy. And if I select SimMan, then we have case 1. So that's where you'll find the healthy patient cases. If I go to the bottom to simulation training, we'll see this is where we talked about those 50 cases earlier. So if I have a look at SimMan cardiac resuscitation, you'll see the 10 cases. So I can select which one of those and then use the checklist that's there. But because we don't have a SimMum, but now we've actually created a tag configuration, what we'll do is we'll actually do the guided training for 6-step, just so we can give you an example of that. So if I select that one and then case 1, then this window will appear. And really what this is doing is just giving me an overview of sort of how the training works. But on the right-hand side, you actually see the case overview. So each of the steps covers a different facet of the actual 6-step OB examination. So you'll sort of see there from cases 1 to 9 is really about learning, but each time that you do it, you're going to be given a different presentation. So say, for example, the baby might be in the normal upright position, and then the next time you do it, it will be breech. So if I select continue, this is our first look at the actual ultrasound interface, and you always get given the case history on the screen, so we can just click OK to remove that. So now we're looking at the ultrasound screen, and really this is the same screen that you'll see on all the cases. What makes the self-directed guided cases different is this avatar on the left-hand side, so this section here. And we can sort of see that we have the mannequin there, but we also have the tag locations, and the tag location that is being used for this particular step is the one highlighted in blue. Underneath that, we have a text box that then basically gives us the step-by-step approach. So what it's saying, Hannah, here is if you want to place the probe on the lower uterus window, which is the second one from the bottom, there we go. And now, now we're actually starting to see the ultrasound. So then I would select next. And then it's saying scan through the uterus on both the sagittal and transverse planes. So now if you just move the probe up and also down, you can sort of see now we're actually manipulating the image. And if you turn the probe so it's upright, that's it, just rotate it. And then again, move from side to side. Now we just saw the baby's heart there, which was really interesting. But yeah, so basically what we do is we actually follow the steps all the way through the program. So again, you would work through all of the cases, and then in the final case, you would actually do it. So what we would do is just continue to click next until we sort of work through, and of course you would move throughout the body to sort of perform the 6 step. When we talk about the guided case for SimMan, really the process is exactly the same, but of course the protocol is either focusing on the eFast or the Rush. The main difference that you'll see on screen is the avatar will be a male mannequin, and it will just show the tag locations for that particular simulator.
Okay, so Danny, once you have completed the guided cases, will the ultrasound images change the next time you do it?
No, they won't. So within the guided cases, the images are sort of fixed. But of course, you can do the guided cases as many times as you would like. You can go back to the start at any time. But I guess once you've finished the guided case and you're comfortable with the process, then you can use the other scenarios that are within the ultrasound solution to be able to practice. So an example would be, say, for example, we just finished the SimMum 6-step OB. You could then use the 10 SimMum cases to be able to practice on.
Yeah. Okay, so you mentioned checklists are also available. Can you show an example of one of these and how they would be used?
Yeah, sure. So what we've done is we've sort of produced a sort of a checklist, and I'm sort of showing it here with information at the back. I think we're putting it up on the screen for you just so you can sort of see. But the idea was that could we use this particular simulator as a part of task training or peer-to-peer? And of course, yes, we can. But someone needs to know what it is that we're going to see. So what we did was when we created these checklists, we provide information like the actual case history. So this sort of explains what happened to the patient. So that's sort of important to start thinking about maybe where you might find injuries as an example. We also give you the initial state as well, so the initial observations. So then that way, you can think about heart rate, blood pressure, and those sorts of things. And then last of all, we sort of have the table that actually shows the ultrasound findings for each of the windows that are active in that case. But we also provide the diagnosis.
Okay, so for peer-to-peer training, where the faculty or staff may not be available, will the learners need to also learn how to turn on and off the simulator?
No, I guess that's one of the nice things about if we are using the product in that peer-to-peer is the mannequin doesn't need to be turned on. So really what they need access to is the ultrasound PC and also the probe, and then obviously the mannequin skin, or they could even use that paper-based simulator that we showed earlier. The only time that you would need to turn the simulator on is if you wanted to change the heart rate and respiratory rate. So that would be the only time that you would need to turn the simulator on.
So changing the heart rate and respiratory rate of the ultrasound images sounds interesting. Can you show us this?
Yeah, sure. And this is one of the features that we're actually really excited about, but I'll need to get you to give me a hand. So we have a SimMan here, and he's connected to this Leap PC. So if you can control that for me, maybe what we'll do is just start with a demonstration of the respiratory rate changing. So what I'll do is I'll jump on the mannequin's right chest window, okay, and we can sort of see that I'm just bringing up the ultrasound image there. And what we'll do is we'll share on the screen both the ultrasound image but also the Leap PC. So Hannah, perhaps if you'd like to change the respiratory rate, maybe up to sort of around 50 or 60, please.
Yeah. 60?
Yeah, that would be great. Okay, so what we're seeing now is an increase in this sliding that's there. So perhaps now if we slow it down, and perhaps let's just take it back to maybe where it was around 20, but let's do that over 20 seconds. Because what will actually happen is that the respiratory rate will actually follow the patient monitor. So as the patient monitor falls, that's actually the rate that it's getting. And of course, the same on the mannequin, things like pulses and those sorts of things are all aligned also. Okay, now we can sort of see it coming back to normal. So let's do the heart rate now. So what I'm going to do is just pick up the heart in the subcostal window. So let me just get a good view of the heart there. There we go. We can sort of see that it's beating away. And I think the rate must be around 70-ish. Is that right?
76.
76, great. So now let's take the heart rate up to, say, 150.
Yes.
There we go. And now we can sort of straight away see that the heart is now compressing a lot faster at that 150 rate. We can also use trending for this as well, Hannah. So perhaps if you slow the heart rate back down to maybe around 70 where it was, but let's do that over 20 seconds. And then that way we'll be able to see the actual heart contraction sort of marry up along with the patient monitor. And of course, one of the benefits of this is that way when you are running a simulation and you do want to change the heart rate and respiratory rate, you sort of know that whatever rate you have set will be what's displayed on the monitor. And now you can sort of see that we're getting back to that 76.
So just a question from me. Can you program your own scenarios using Sim Designer?
Yes, you can. This has only recently been created, but we sort of created it because this allows customers to use our ultrasound cases exactly how they would like. So what we've done is we've actually have these initial scenario templates or blank scenario templates. They're available for download from Laerdal.com. Once they're downloaded and installed on the Leap PC, you can then open them and then run them in auto mode. And of course, you can either run the scenario on the fly, so just take the scenario wherever you would like it to be. But if you are comfortable with programming, you can definitely open it up in Sim Designer, build your own scenario with your own scenario flow, and then save it and then run it anytime that you like.
Thanks, Danny, for showing us the new features of the Laerdal Sonosim Ultrasound Solution 2.0, as there has been a lot of new changes. For those interested in seeing the new resources that have been developed and shown throughout this webinar, at the end of the showcase we'll display QR codes for each that will take you to where these resources can be found. So we have received a lot of questions during the webinar, but perhaps you can answer some now?
Sure.
Okay, so let's start with question 1. Can I upload and use my own ultrasound images with the LSUS 2.0?
Yeah, no, unfortunately you can't. And really the main reason for that is that the ultrasound images that you would be taking would be a video file. And of course, the way that we've developed this product is that these are real ultrasound images, but they've also been shot from different angles and they're controllable with the probe. And of course, that's what Sonosim's technology does. So unfortunately, no, you sort of have to use the ultrasound images that are provided by us. Okay,
so question 2. Can I upgrade my existing LSUS product to LSUS 2.0?
Yeah, certainly you can. Basically, to do that, it's an upgrade purchase. So effectively what you're doing is buying a 3-year subscription, and that 3-year subscription will give you access to all of the new features that I spoke about, but it also includes all of the content, so things like the healthy cases, the actual cases that are available for that compatible simulator, and also the guided cases as well.
Okay. So we have a question about, you showed changing the respiratory rate when you showed lung sliding,
yes.
For example.
Yeah.
Can this movement be seen in other ultrasound windows or locations?
Sure. Yeah, so I know that when we did that, we actually just showed the right chest. But let's just say if we now share the ultrasound screen again, if I just pop the probe onto the upper right quadrant, we can actually see the diaphragmatic movement that's there. So I guess when it comes to seeing things like heart rate and respiratory rate, it's really any window where you would normally see that reflected.
Okay. Will this product be available for other simulators?
Yeah, again, another common question that we get asked, but unfortunately right now it's just for the SimMan Brothers and also SimMum. But definitely, we've had discussions about, maybe opening this up for pediatrics, so it could go on SimBaby and so on. So it's definitely possible, but it's not something that we've moved to, but it's certainly something that we're open to explore.
Okay, thank you. We are unfortunately out of time. If we didn't have time to get to your question, we will follow up with you after the showcase. So the QR code are about to be displayed. That will direct you to all the resources we talked about, and will include links in the follow-up email to this webinar. Thanks again for spending time with us to showcase Laerdal Sonosim Ultrasound Solution 2.0.